Help, sorry. Call the insurance committee meeting, group insurance committee meeting to order for August 24th, 2022 at 4:04. First thing we'll start with is roll call, please.
All right, Jeff Balzo, I'm present. Eric Diamond,
Present.
Mike Dixon,
Here.
Rachel Drake,
Here.
Vicky Cooper, absent. Diane Lyon,
Here.
Tony McMillan, absent. Donna Echeverry is also absent. Robert Munson.
Present.
All right, we have a quorum.
Okay, and without objection, we'll follow the adopted agenda, except for, I do want to note before we start that item 2.01, presentation and discussion of the Washoe County School District Insurance Internal Fund as of July 2022 will be removed from today. We'll visit it at our next meeting. Okay, let's go ahead and go to, what's that? Didn't we move public comment to the end? Yeah, I thought we did. Okay. So 2.02, presentation and discussion of Washoe County School District Group Insurance Claims Experience Report as of June 2022 and July 2022. Welcome, Lloyd.
Good afternoon, everyone. Lloyd Barnes with LP Insurance Services for the record, and we are going to actually go through 2 months of reports, and we can probably sort of double up on them because they do run cumulative. So it looks like we're focusing on the July 2022 report first, which I'll go back and hit on the June data as well, just briefly. Let's see, so turning to Exhibit 1, as we get into the first full 6 months of the year, you can see there on the executive summary that our enrollment counts are fairly stable, down a little bit. Employee counts are down 1.4% so far this year, with dependent counts down about 3%. Looking at the paid claims for as of the current month, the net paid claims came in at about 5.3 million versus 5.56 million last year, so down about 3.6%. For a composite cost, down about 2% at 763.23. Overall, our fixed costs are down actually quite nicely at $389,000 average for the year so far versus 418, so down about 7%, which gives us a total plan costs of 5.75 million versus 5.98 last year at this time, and that gives us about a 3.8% reduction on a composite basis. That's 818 versus 839, down about 2.5. Again, as we've looked at the large claimants and discussed in previous meetings, those numbers are nicely down. Again, hopefully that holds a bit, down to currently we are tracking about four claimants. So we get into Exhibit 2, our little graph that we've reviewed. As hoped and now materializing, the plan costs have stabilized a bit when we look at it. Bless you. When we look at them on a rolling 12-month average basis, you can see there for the last few months now that has leveled off nicely. So again, we're gonna hope that holds for a bit, but we are still seeing elevated costs from the previous period. So that all is pretty static. In looking at Exhibit 3, did I mess up again and read off the wrong report? I did. Sorry, guys. In looking at Exhibit 3, where we actually go by month, you can see there that for the July 22 data, the composite cost down on the bottom for claims came in at 815.20. And our adding in our fixed costs, we're coming in at 870.67. Over on the far right, bottom line, number 35, 826.01 for the current year average versus 839.46, down 1.6% for the year so far. Let you all review exhibits beyond that, where we break out the active and retirees with the different plans. We will move forward to our exhibit 12. And you can see there we did have 2 new subscribers presenting in the month of July that we're starting to track now at the $212,000 level. The other ones have generally stabilized, with the exception of number 4 there. That claimant is still incurring some significant costs. And that is the only one at this point that has exceeded the specific deductible of $425,000 at this point. So all in all, for July, things are looking pretty good. I think, quite pleased, I think, from the standpoint of where we've seen some of the costs trending for the previous few months. Can take you back to June real quickly if we'd like to just sort of touch on that. No real notables there, other than we're just sort of continuing that trend in July that we were seeing in June. That would be my main point for the June data. And I don't know if you can fast forward over to the June report, which could have done these in reverse, but that's okay. Okay. It did get broken out for you guys. Okay, I think it was because we didn't have the June data last month that it got added to this agenda item. So I think it's pretty straightforward. Any questions that we can go deeper into for the month?
No questions? Okay, thank you.
Thank you.
Appreciate it. Let's see. And we just did 2.02. So we're on 2.03, presentation and discussion of the Washoe County School District Group Insurance Anthem Claims Activity and Turnaround Reports as of June 2022 and July 2022. And welcome.
Hi, good afternoon. Pam Davidson from Anthem for the record. So I'm going to go over June first, and then I'll touch base on July. So in June, we processed 14,270 claims in the medical. 91.68% processed in 14 days, 98.58 in 30, 99.71 in 60, and 99.89 in 90 days. We also had 7,256 RX claims, and those are processed at times of service. In June, out of those 14,270 claims, 12,838 were from the PPO, and let me just read. And I had 1,432 in the HSA. Moving on to July on the medical, we had processed 14,210 claims, only 60 difference. 12,845 were processed in the first 14 days, leaving at 90.39%, 98.94% in 30 days, 99.87 in 60, and 99.97 were processed within 90 days. In July, we had 6,867 RX claims at that time. Out of those 14,210 claims, 12,802 were on the PPO. And I have them in two different windows here. 1,408 in the HSA. Does anyone have any questions on the medical turnaround report?
Any questions? Seeing none, thank you very
Okay.
much, appreciate it.
All right, do you want me to go over the dental too? Okay, dental, we have, in June, we processed 2,569 claims. Within 30 days, all of them, 100% are processed. 91.18% were processed within the first 14 days. In July, we had 2,360 claims, 92.23% were processed in 14 days and 100% in 30. Any questions on the dental turnaround?
Any questions? Okay, seeing none.
All right.
Thank
Thank
you
you.
again very much, appreciate it. Okay, item 2.04, presentation and discussion of the Washoe County School District Group Insurance Wellness Program report to cover current events and programs as of July 2022.
Hi everyone, Mackenzie Howard for the record. For the first wellness program update, we have our health assessment. So the health assessment will be open from September 1st, next Thursday, through December 1st. So that due date is the same as last year. This is the assessment that members will have to complete in order to receive their health premium discount for the 2023 school, calendar year. And the yearly mailer that you typically get around this time is, I spoke with our print shop this morning and they were printing it this morning. So it should be early next week that you get that in the mail. That will have all of these updates for you and our members. Our next update is our wellness screenings. And so our wellness screenings are back on site. So members can get their wellness screening done at Specialty Health or LabCorp anytime between September 1st through November 15th. If they would like to attend one of the 19 events we have planned on site, they are more than welcome to. They just need to make an appointment on our website. So here is the list of all of our events we have planned. We have all 12 of our major high schools, 3 at our central admin building in this room, and 4 specific days at Specialty Health. Our third update is through December, we are going to host 2 wellness webinars every month. So it's we focused on Wednesdays and Tuesdays at 4:30, and the registration link for all of these will be posted on our website as I receive them. For the last update, we are bringing back our Wellness Ambassador program. And when I sent these notes to Veronica, we had 62 Wellness Ambassadors. But just yesterday, I had 2 more people volunteer. So we now have 64 Wellness Ambassadors, which means we have 44 school sites and 7 departments. And before you get concerned about my math skills, we have a couple sites that have 2 or 3 Wellness Ambassadors, which I'm pretty excited to see how that works out. The Wellness Ambassadors are tasked with their typical, what they have been in the past, of creating a culture of wellness at their site. But we are going to give them a little bit more information this year in hopes of supporting them in creating that culture. So they will be given resources, education, and activities with the goal of increasing our staff members' awareness, knowledge, and self-efficacy in their health behaviors. Does anyone have any questions for me?
Go ahead, I'll let you go first.
So, my primary question is the specialty health sessions. Is that a single location or are there multiple locations that members can visit?
For just the specialty health,
Yes.
it's just at Liberty Health,
Okay.
at Liberty Street.
Thank
Yeah,
you.
Of course, that's where they were last year. If
Okay.
that helps. Yeah.
Other questions?
Is there another question over here? Hi.
Eric?
Yeah.
Eric Diamond for the record on your wellness webinars. Is there still a point value to these? I have
Yes,
some
they
people asking
will.
that.
Yep, they will be rewarded in Virgin Pulse, but they'll have to give me just a little bit of time to send that file over to Virgin Pulse so it can be implemented there.
Right.
Yeah.
No, just as long as they're going to ask the same thing. Is there still a point value?
Yes,
All
we
right,
want
good
to
deal.
reward them for going.
Thank you.
Yeah. Any other questions?
Yeah, I was just
Go
going to
for it.
ask if you could remind us what vaccinations will be available at the wellness screenings at the high schools?
Sure. They will have the flu shot high dose, pneumonia, Tdap, and shingles.
Okay, awesome.
Yep.
Any other questions? Okay,
No.
thank you very much.
Thank you.
Appreciate it. My agenda, which sorry. Moved my agenda and I lost it. Lost my place. So 2.05, discussion of the Washoe County School District Insurance, new hire 90-day benefit waiting period for discussion.
That would be me, Laura Thurston, for the record. Okay, I just wanted to bring back the updates that we have for working on the closing of our 90-day wait. I think last time we spoke, Emily discussed maybe us coming back every couple of months. So we are currently still working on the testing of the portal. I don't have amazing news in terms of, I was hoping that we would be up and live by now. The good news is we are testing live people. The bad news is that we are hitting several roadblocks in terms of the actual portal functioning and being efficient for us. What's happening is there are several bugs or glitches when the members are going through, and once those are fixed, it's affecting other things as well. So again, this portal is something that our internal IT program is building for us specifically to match up to our Business Plus program. So that's wonderful that we have that and it's coming, but we're not there yet. Hopefully I have better news in terms of that in a couple of months, but I know that our specialists were testing it with with Julie this morning, who's from IT, who's been wonderful in building this for us, and we were having several issues, unfortunately. The good news, though, is we're continuing to do that, and we're continuing to look, and we're continuing to have discussions with leadership on other ways of how we can start to decrease this window and what might be needed. So I'm excited for that, but I just don't have any updates in terms of time frame of when and what can really happen quite yet. But any questions?
Any questions?
Okay.
Not questions, of discussion.
Okay, go ahead and discuss.
Okay. So we're at a spot where we've got a process that we're working on, and we're making progress with that process. So I'm very excited to hear that. We also know that we've been in a situation where we continue to say this would be a good thing for many people coming on board, and we would really like to see this happen. One of the things that really came back and pushed at us hard in these last several months was that the board was not offered enough opportunity to include this in the budget. And so I would like to have some discussion about when do we get this pushed through here so that the board has enough opportunity to include things in a budget to perhaps look at a June 23 implementation of a 30-day waiting period.
Jeff, you want to take that?
Yeah, I'll take the budget question. For the record, Jeff Balzo.
Thank you.
So the budget process starts in early January to try to start accumulating all the things from that, requests, other items that people want included in the budget. So we would need it by early January, most likely.
And it's my understanding, I think that, if we, make a motion at some point and take that, then that would go to the school board. And my understanding or my feeling is that a lot of this is going to come out of leadership probably in the next month or two as well. That's my sense of things that there's two fronts to this. There's obviously the insurance committee, but then there's also how do we implement something. So, before it gets to the point where it goes to the board, and I think Laura's said leadership sort of working and discussing how that would work as well. So I think that's really good news, at least in my eyes, that this is on the radar of leadership, and that it's not going to be, they're not going to be blindsided at some point, and we're not going to be jumping ahead of them, hopefully. Laura?
Yeah, so this is Laura Thurston for record. Just to piggyback off that, yes, I think leadership is looking at this heavily, and I also want everyone to keep in mind this is not just a benefits. I hate to say the word problem, but it kind of is, right? It's not just the benefits department. It's our whole onboarding process within the school district, and obviously our whole systems as well. But in order to close this, we can have great systems, but we also have to have an onboarding process that starts with other parts of HR as well, where we're getting employees in before the fact. So, meaning we're getting employee information in before they're hired or before they start date, that type of thing. So if we ever want to get to, let's say, if we do want to get to that 0-day mark, that requires a lot of information up front that we're not currently getting. And it's not to put blame on anyone. It's where, we're in a period where we're really needing, teachers in classrooms. And so we might not have that information, and they're already in the classroom and they're hired. So it's just looking at those systems and trying to refine that and deciding, where is that break-even point? Which I don't want to say one is more important than the other, but where are we willing to give at some areas?
Diane Lyons?
Diane Lyon for the record. I have a question though about the 90 days. Wasn't there, and somebody tell me if I'm wrong, a cost to doing 30 days, 90 days per employee about implementing insurance for
Jeff?
them?
For the record, Jeff Balzo, yes, there was a cost to that. So I think it was to go from 90 days to 0 days was roughly $1 million.
Any other questions? Obviously, this will be an ongoing discussion. We'll continue getting updates and seeing what happens with it, but
Yeah. So the cost of $1 million is the general fund cost, and then so we don't have a good estimate of what it would cost our Fund 36, which is our health insurance fund as well. So there'd be that additional cost, which we would know once we incur it for the most part.
there might be additional costs to the insurance fund, but there would also be then the money that it's costing the district in the general fund would be coming into the insurance fund, because that would be
Yes.
premiums that would be
Yeah.
paid. So ultimately, yeah, I'm not saying it's a wash, because it's not. That's the budget for the district, totally got that. But, what would it cost the insurance plan? I would hope, on one level, that people aren't putting things off for 90 days that could cost us more if they were preventative or dealt with right away, rather than ending up in surgery or ending up with a kid in the hospital or something like that. So, we never know what the costs of the insurance are going to be for that, but it's going to put more employees on it, right away for an extra 90 days to our insurance for the year. So, it could be costly, but it also could be just a lot of premiums as well coming in, so. Go ahead, Eric.
Eric Diamond. So obviously for the board, for this body, it's a pretty simple question of, do we want to bring this down? And I think we've definitely had exhaustive conversation over the fact that we want to bring it down. I think we're getting mired a bit. I mean, we're conscious that this has multiple components, but I think we're getting mired into areas that we don't have any control over, i.e., the personnel ability to bring people onboarding and whatnot, which is it's a great consideration that we have to bring into our decision. But the simple portion of it is that the only thing being brought to this body is, do we want it to be 90 or do we want it to be 30 or anything in between? We want it to be less. And I'm not sure that, we can continue to discuss and obviously collaborate with our other parties, but in the end, we can't do anything about onboarding or new processes or whatnot. So I'm kind of with the panel or the group on this to continue to receive information, but I think we've also answered this question on several levels. I think we should definitely move for a motion at some point here soon.
And I think one thing to think about is certainly, I think we are all on the same page there. And I think at some point we make the motion, it goes to the board, and then, they have to figure out what they're going to do and leadership and everything else. But yeah, so I definitely think that there is a point where we need to do that. And I think if January is when we're looking at budget, we probably want to do something in November, so that there's time for those discussions to happen and how, how that's going to play out. But, and give us some time to work on that as well.
Definitely on the budget end too. I mean, obviously, I think we have an excellent financial department that has provided us the cautionary look at the possibility of costing $1 million. The district does an excellent job, I think, overall of making sure that we understand the full potential cost, but then there's also realized cost in the fact that we don't have 100% staffing. So that $1 million is the full potential, but likely to be realized at much less.
Seeing no other discussion, close that topic. And we have the approval of the minutes we're looking at, didn't we change the date on July 20th, right? I must change it. I brought my own minutes, okay. Approval of the minutes for July 20th, 2022 meeting of the Group Insurance Committee. They were sent out if you want to take a moment if you need to look at them. Otherwise, we'll take a motion. Jeff?
For the record, Jeff Boswell, I moved to approve the minutes from the July 20th meeting.
Okay, do we have a second?
Rachel Drake, I will second.
Okay, it's been moved and seconded to approve the minutes of the July 20th, 2022 meeting of the Group Insurance Committee. All in favor? Is there any discussion? No? All in favor, say aye.
Aye.
Opposed? Okay, motion passes. Okay, is there any public comment this time? Okay, closing items. Our next meeting will be September 28th, 2022, here in the boardroom. And without objection, meeting is adjourned at 4:32.